Stroke is a focal neurological deficit, which is of no other origin but cardiovascular in origin. Depression is the leading cause of disability. Depression on its own is a persistent feeling of sadness, a persistent feeling of hopelessness.
Hello, welcome to Health Watch on Anglican Cable Network Nigeria. I am Angela Mweze. On today's episode, we shall be discussing fibroids, or better put, uterine fibroids. Fibroids are the most common tumor of the female genital tract, especially in women of reproductive years. It has a global prevalence of 21.4% as of 2016. Interestingly, the incidence of fibroid is threefold higher in women of African descent than women of other descent. We shall find out why and other information from our guest. He's an obstetrician, gynecologist, and the medical doctor of the Medimax Hospital, Abuja. He is Dr. Odiegwu Maxwell. You're welcome to the program.
Thank you so much.
You will not imagine how much I've been looking forward to discussing this topic on fibroid. Really? Yes, because there's so much I don't think there's a week that has gone by and I haven't seen somebody that has this issue. Yeah. And there's so much information out there. So our whole aim today is to ensure we educate everybody on what it is, what it is not, and how to manage it when they find out they've come down with it. So what is fibroid? So I want you to help me, describe the lining of the womb, and then what fibroid is in this.
Well, fibroids are they are growths that are found in the muscle of the womb. Some fibroids can grow within the muscle of the womb, some on top of the womb, while some can be found inside the cavity itself. So depending on the location of the fibroids, the symptoms vary. Yes.
So we're looking at the womb, like the V-shaped womb that
that's the cross section.
The cross section.
Yes, you can have some within the muscular component of the womb.
So that's the one in between, not the middle, but the
those
one.
Those are called intramural.
Intramural.
Fibroids. Then you have submucous fibroids. Those ones are found within the cavity of the womb. Depending on the size, the symptoms will also vary. Then you have subserous. Those ones they don't really affect much in any way in terms of conservation. They are very, very big. So it may not be very common, but they are less notorious.
Less notorious than the other two.
Yes.
But of these two, anyone much of a problem?
Submucous.
Submucous.
That's within the cavity.
Within the cavity, that's where the problem is.
Because it may affect implantation in some cases because of the size. Then it also may make one bleed more. Yes, during menses, because now the surface area of the inner lining of the womb has increased. So women with submucous fibroids will have heavier flow than those that do not have fibroids.
Whenever people hear the word tumor or growth, what comes to their mind is cancer.
Yes.
Can it ever be cancerous? Have there been cases where you found out this fibroid and later it became...
There is a very little chance of a fibroid turning cancerous. In fact, it's less than 1%. It's even less than 0.05%. It can turn to leiomyosarcoma, and it's not that common. Most of the time when we do fibroid surgeries, we send the samples for histology. And in very few cases, rare cases, that you see the result turn out to be leiomyosarcoma.
Yes. So to clear the air now, we can categorically or clearly say that fibroids are not cancerous.
They are not cancerous. So because if we say 99.5% are not cancerous, then
so that's clear.
It's not that common.
So it shouldn't be a cause to worry.
No, it should not.
It shouldn't be a cause to worry when it comes to cancer. So what ages are prone to? I know in my introduction I talked about reproductive years.
Yes.
This would be within what age range?
We're looking at 19, 20 to fibroids. The mechanism of action, that's the thing that causes more of the hormones. And these hormones, like estrogen, they are produced more during the reproductive years.
Okay.
Fibroids will not grow bigger after when menopause sets in. Because the hormones have the levels have really gone
down at that time.
So reproductive age, that age group that women have babies, that is when fibroids are problems.
So it will be as a result of estrogen. Maybe at that point, of course, your estrogen levels keep going high.
Yeah.
At that point. Now, let's look at the causes. What would have caused fibroid? If you read around, people say we don't know what causes fibroid.
But that is the truth. Nobody really knows why fibroids are there. We may have associated factors, as you said earlier, in terms of the fact that it's more common in Afro-Caribbean, women of Afro-Caribbean descent.
Yes.
Any black woman is prone to fibroids. So that we know. But there have been some postulations. I don't want to bore you with a lot of medical jargons, but essentially, it is not, we won't say this particular family is prone to. But once you're
so it's not
woman,
genetic. It doesn't have any genetic.
I would not say so. I would not say so. But what we know, when the uterus has been empty for a long time, fibroids grow.
So when you mean empty, no child has ever grown?
Yes, when there hasn't been any pregnancy.
Okay.
You know.
Okay.
Nature has a way of trying to occupy the place.
So the uterus has to be occupied all the time. Well, the way it was made,
when we say long time, nothing is happening
there.
So that's then they say good girls have fibroids.
What does it mean good girls have fibroids? I thought all ladies are supposed to be good.
When the uterus has been empty. Okay,
so a lady that has never gotten pregnant before or have never been involved in any form of sexual intercourse is more prone to.
Yes, that's what I'm trying to.
Oh, I see.
It's just an adage that's really bad. So usually people that maybe get pregnant or have children, the fibroid may be there, but it may not grow big enough to cause problems.
A problem. Okay, now I think I read an article that said. No, I read an article that said that all ladies have fibroids. Just some grow, some don't. Some just stay, they never grow.
70 to 75% of ladies who have fibroids. My mother had fibroids. She had 6 of us. She didn't have to undergo any surgery. Okay,
it was just there. It didn't grow.
Fibroids can actually coexist with pregnancy.
Okay.
If it's not too big, pregnancy can stay, and you can still have your baby without any need for surgery. In fact, the indication for surgery is when it becomes symptomatic.
Okay.
Maybe it's too big, your clothes are no longer fitting, or you are bleeding so much, or it's causing miscarriages. Those are or sometimes when you have an anterior fibroid, because the anatomy is such that the bladder is just in front of the womb. So when the fibroid is too big and it's anteriorly placed, it tends to impinge on the bladder, so that urinary symptoms begin to set in. You can't hold urine before you get to the bathroom. You may need to speed. So that's also an indication for surgery. Otherwise, no gynecologist goes chasing a fibroid, except there is an absolute need for it. Yeah.
So, in other words, because from the few information you just given us now, it's not really something to worry so much about, because when a lady maybe you go to the doctor and they say, okay, you have fibroid, no matter how little it is, the lady starts panicking.
It's the onus of the doctor to reassure the lady.
Okay.
You can have tiny follicular size fibroids, very tiny fibroids. Those shouldn't be a cause for concern. The doctor should be able to reassure the lady, madam, they have fibroids, but it should not be causing any problems.
Okay.
So those are not the kind of fibroids you want to go and take out. And we should also let our viewers know that fibroids can regrow even after removal.
Okay.
So that's why it's very important that whenever you need to decide that a fibroid should be removed, you must also consider the fact that they can still come back after some years. For some people, I've seen 2-3 years, I've seen 5 years, I've seen 7 years, I've seen 8 years.
Before growing back?
Yes. So you should be certain that this woman her life will be better if after you have removed the fibroid.
Okay.
If it's not disturbing you, in quotes.
Okay, so
you should not bother.
If it's not something that's giving concern or beginning to.
You shouldn't bother taking it out, because a second fibroid removal is technically more challenging than the first.
Okay.
And you need a ton of experience for you to go through a second surgery, because there are more complications that are likely when you go to do a second surgery operation.
Okay.
Fibroid operation.
All right. I want to talk about estrogen.
Yes.
The estrogen you mentioned the bits about, and I also read a study that related estrogen, with women that even take the pills for whatever reason, they found out that they came down with fibroid. What would have been responsible? I know there's a whole medical term, but in simple terms of what could have caused.
The pills are a combination of estrogen and progesterone. There's contraceptive pills, you mean?
Yes.
And we also, you may have to take the pills for some time, not like a month or two before you start having problems with maybe the fibroid may have been there. Maybe it's very tiny. Then the pills will now make it bigger.
Okay, so there's something estrogen is doing to the fibroid that is making it grow.
Yes.
I would assume.
Yes, tends to cause multiplication of cells and increase in size over time. That's why it's also common in the reproductive age group.
Okay.
And estrogen is very important for the woman.
That's what I'm thinking, because there's nothing you can do. It goes high at every point.
It's just one of the theories. It doesn't mean that is the reason.
Okay.
Yes.
Okay. But can it grow in anywhere around the fallopian tube?
Yes, you will have cases of parasitic fibroids that can be found outside the womb.
The womb area, okay.
Even ovarian fibroid, cervical fibroid on the cervix, then the fallopian tube, but they are not as common, and they are rare.
That would be very uncomfortable if somebody would have.
Well, they are usually not very big.
Okay.
Because fibroids also need some form of blood supply, and the womb is just a perfect
environment
for that to happen. In those other areas, blood supply is not, especially like the fallopian tubes, so it cannot flourish that much.
Now, in the introduction, we talked about the African women.
Yes.
Is there would there be any reason in particular why women of African Caribbean descent will have more of this fibroid than women of other descent? Yes, everybody gets the fibroid, but it tends to be more aggressive, I believe, in women of African and Caribbean descent. Would there be any reason?
It's not for Caucasians. It's not a problem.
Okay.
It's not that much, but for black women, for reasons that we don't really we can't really say, it's quite common. For us, when we may say, okay, known factors, unknown factors, associated factors.
Okay.
The important thing is that this thing is there, and we're trying to do something about it. There are some situations that you don't even know what is causing it, but as long as you can find a solution to it, you are not trying to see this is the cause.
Okay.
Yes.
Okay. So, but
we have been found that it's very common. Any woman that is of Afro-Caribbean descent, Jamaica, the Caribbeans, all those other places, and Africans. So
it's a problem with us.
It is.
So I think more research should be done in our area in regards to this thing. Let's look at issues of risk factors that predisposes a lady to fibroid, because now we don't know the cure. We don't know. I beg your pardon. We don't know what is responsible for it. But of course, there have been suggestions here and there. But are there risk factors? Like we don't know what exactly causes cancer, but we know that there are risk factors that predisposes
for fibroids as well. There are quite a number. Some, they'll say some diets, even genetic association has been implicated as well. But you see, most of these things are things that are trying to postulate.
Okay.
Yes.
Okay.
Certain diets, and then the issue of whether the black woman thing, then estrogen as well.
And of course, because you're a woman, that's
yes, because the womb is there.
The womb is just there. Okay, we're going to go on a quick break. When we return, we'll talk more on treatment, management, and other part. We'll be right back, viewers.
Hello there. Have you ever wondered why Jesus spoke in parables? What do you make of the word parable? Do you find it hard interpreting parables on your own? Don't worry, we have answers to those questions on Parables. Parables is a program that brings to bear what parable means and how it affects our day-to-day lifestyles, the church, the individual, and the society at large. Join me, Nzubechi Frank, as we explore the significance and the innate meaning of each parable of Jesus Christ. Coming to you every Saturday, 1 to 1:30 p.m. with repeat broadcast on Sundays, 7 a.m., Tuesdays, 3:30 p.m. and Thursdays, 7 a.m. from the Anglican Cable Network Nigeria, ACNN. God bless you.
Welcome back. Just in case you're joining us, we've been discussing fibroid on Anglican Cable Network Nigeria, and our guest is still Dr. Odiegwu Maxwell. So before we went on the break, we talked about fibroids. It can never be cancerous. That one, it can be, but
very minimal.
It's very minimal,
yes.
Very minimal. And then we now know that we don't know what exactly is responsible for it, but we just have postulations and suggestions as to what could have been responsible. So now we want to talk about the area that gives concern the most, and that is the treatment or management of fibroids. Can it be treated? Let's start with that question.
When you say treatment,
okay, can it be treated, managed?
Yeah.
Okay.
You can manage fibroids, but first of all, I must say that not all fibroids should be treated.
Okay, or should be touched, or
yes, okay. Because the truth is this: if there are no symptoms, do not bother. If it's going to grow bigger enough for surgery to be done, it may eventually come later. Some may not grow beyond a certain size, and you can have all your babies with the fibroids still there. It's only when it becomes so big that it may have probably affect pregnancy or maybe symptoms and heavy bleeding. Then that's okay. Let's do something about it.
Okay, so to take that again.
Yes.
If the fibroid is not causing any form of discomfort, or it's not harmful in any way.
Yes.
Then leave it.
Leave it. Even in some couples that come for fertility treatment, fibroid removal is the last thing that we do. You have to do all the other investigations.
Okay.
Make sure that the fallopian tubes are open. Make sure that the lining of the womb is fine. Make sure that the husband's sperm count is okay. When all these tests have been passed, then you now look at the fibroid. In fact, if the fibroid is not too big, you may not even decide to go for it. The truth is this: fibroid removal in a place where it's not properly done can even complicate your problem.
I was going to talk about that. Okay. So
because some doctors and not gynecologists also remove fibroids, but you see, competence and
experience
is also very important, because we have seen incidences where the fibroids were removed and the patient's situation got worse. Maybe her periods changed, or she was no longer seeing her period. So that is why you have to weigh the benefits of the removal of fibroid against the risks.
Okay.
And you must also go to a place where you are reassured that your fertility potential is not jeopardized after the removal of the fibroid.
Okay, I think that's like one of the most important things we're going to be, stressing on this. So if the fibroid is not giving you any cause of concern, leave it where it is.
Leave it where it is.
And if for any reason you're going to take it out, you need to go to a professional who is a gynecologist, who is an expert in this. And they have to do proper investigation.
In fact, one of the investigations, hysterosalpingogram, is to assess the patency of the fallopian tubes.
Okay.
It is essential that it should be done for medical legal reasons before a fibroid surgery.
Is it important to ask the doctor some of these things? Because I'm sure there are people listening.
Yes.
Is it important if your doctor comes and says, okay, we need to take out the fibroid, you can ask him, have you done this test? Is everything okay?
You can ask your doctor any question.
Okay.
Even for the doctor's good. Some fallopian tubes may have been blocked before the fibroid
started growing.
Before the fibroid is to be removed.
Okay.
So when you do that test, you'll be able to know whether the tubes are open or not. Because the tubes may be blocked but you still go ahead and do the surgery, so that there won't be a situation where after the surgery, then that test is now done, and it will now be like, okay, my tubes are blocked. It will now be that, oh, maybe it's because of the surgery.
Okay.
So it's better for you to do it before you do the surgery, so that you even know if it's open. We expect the fallopian tubes to be open after the surgery.
Okay, so all right, now it's making a lot of sense. So this should be the last resort, actually.
That's very last. You have to do all the tests. Do the hormonal profile, make sure that she's ovulating, then do the HSG, make sure that the tubes are open and the lining of the womb is intact. Then evaluate the husband as well.
Okay. So it's not only a female. It's not only a female thing. If there's a husband,
yes,
the husband also should be evaluated as well.
Yes.
So it's not something of the man leaving his wife in the hospital and going back.
That's another topic. That's infertility.
All right. Okay.
So now it's just about the fibroids now. So like before we digress, don't chase a fibroid if there are no symptoms.
All right. Don't chase a fibroid if there are no symptoms.
Because some people will come to me to, doctor, I have fibroids. I want to remove it. I'm not getting pregnant. The reason may be from another, maybe the tubes.
Okay.
Maybe they are not ovulating well. Maybe your hormones are not balanced.
Okay, so something else could have been responsible
for you not getting pregnant. So that fibroid is the last thing that you should remove if you have tried, you have done the other tests.
Okay.
Yes.
Okay. Now, the important, the painful or sad part of it is the tradomedical concoction.
Yes.
Now, this is first-hand experience. I met a lady who the tradomedical, I don't even use doctor, or mixed charcoal with water, and after grinding with water and asked her to drink it, that it's supposed to crush the fibroid, shrink the fibroid, and then she will pass it out like urine or something. Now, the interesting thing is that this is so prevalent. There's so many people that you meet, young ladies, who they just say they had fibroid and they went ahead and started looking to drink all manner of things. Is there any way this concoction can work on the fibroid?
There is no scientific basis.
Okay.
We may blame some of the women, some of them too may be ignorant, because we know that even some educated women go through that route. So we will not say maybe it's because they cannot afford surgery. That is why they are doing that. Some may not be able to afford surgery as well. But there is no scientific basis to that. In fact, there is no way you can take out a fibroid without undergoing surgery. Taking out a fibroid.
Okay.
There are some medications that can be given to shrink a fibroid. We do that when the fibroid is so huge and we want the size to reduce so that at surgery it will be easier. Blood loss will be easier. But it's not that we are giving the medication so that the fibroids will disappear entirely.
All right.
A lot of research is being done about the use of drugs that will melt fibroids. They are still on it. We are not there yet.
Okay.
Then let me also say that these medications I mentioned that shrinks fibroids so that surgery will be easier and blood loss will be less, they are anti-fertility medications. Let me use that word.
Okay.
Somebody that is trying to get pregnant, we may not give
that particular time.
Maybe someone that has already completed family size and has very big fibroids or sizable fibroids, you want to shrink it a bit so that at surgery it will be easier.
Okay. Is this something you take orally or
injection?
Injected? Okay.
Yes.
Okay.
Like a depot preparation, maybe over a 3-month period before you know.
Okay.
Yes.
All right. So it's important to also ask questions when you see your gynecologist. And yes, to stress that as well, it's not just every doctor you should go to. Just as you said, if you don't go to
for fibroids, we need to at least if you go to a general hospital, you will see their gynecologist there.
Yes.
If you have a fibroid, they will direct you to the gynecologist.
Okay.
Some people do not know that they need to see a gynecologist for a fibroid.
All right.
They probably feel that, okay, I'm seeing my doctor, he should be able to handle such ailments.
Such the taking out
Yes.
or management. So the first part of it is you should make sure it's in a hospital, because there are also places people go to and they give them things to drink. Now, why I'm even stressing on the thing of the herbal concoction, because I had a friend who went to the hospital. She was to have a surgery, and everybody on that ward had the same story, that they gave them things to drink, and unfortunately they started having pain. You know, they're so uncomfortable with it. They tell them, if you drink it, keep drinking it, the pain shows the fibroid is shrinking, you know, and then with time it will go. That's why I'm just staying on that. So we should go to the hospital.
There are so many incidences. We have had to deal with complications of someone that went to such places, then caustic soda was mixed with certain objects and they were inserted into the vagina, and it now caused adhesions. It became a problem. The husband could no longer meet her because of
the clothes.
Everything has. So now you are now having to deal with a corrective surgery. You are not even thinking about maybe fibroids or, you know. So it's so much of a problem. Quite a number of people are not aware of what they are going into, and the general impression about surgeries is dangerous. You may go in and not come out.
Yes.
So those are the things that probably make people get scared.
Okay.
But I think we need a lot of advocacy in that area, and let people know that it's not as bad. Surgery is safer now with anesthesia and monitoring. Most of these surgeries can be done without you feeling that, oh, you may not survive it and all that.
Okay.
Yeah.
All right. So the only way to take it out is surgery. I'm just insisting on that. If it has to be taken out,
yes,
the only way to take it out is is surgery. Now let me. I think I was supposed to do this earlier. Symptoms.
Yes.
What symptoms should the lady be looking out for to say, oh, most likely, or it's like something unusual is happening to me? It could be fibroid. Of course, until there's a proper investigation, you cannot make that conclusion. So what kind of symptoms should alert a lady?
Like if it has grown too big, you may have pain.
Okay.
Then the stomach will be bigger than normal.
So when you say pain in what area? In
the lower abdomen.
Lower abdominal area. Okay.
It may be big enough for you to even notice it when you stand in front of the mirror.
Okay.
My tummy is getting big.
Okay.
Maybe that's the time for you to do a scan.
Okay.
A scan will see a fibroid.
All right, that's
ultrasound scan.
Oh, okay, an ultrasound is what you use to determine.
You see a fibroid.
Okay.
And many people, because if you have done a scan at any point, the fibroid will have shown.
Okay. Okay.
But many people don't have the opportunity of going to do a scan because of the kind of the health structure that we have. So, except maybe a friend advises you, why not just go and do a scan? That's when you probably notice that there is something, because I've had such enlightened, everything, graduate. There's something. I told me I can't even feel anything, but it's like a friend will now tell you to go and do a scan.
Okay.
Otherwise, you wouldn't even have bothered to. That's one. The size, then heavy menstrual flow.
Okay. Okay.
When you have a submucous fibroid, your flow in terms of volume per day increases. Sometimes the number of days will also prolong.
All right.
It may or may not come with pain.
Okay.
Heavy menstrual flow.
Okay.
Then, as I mentioned earlier as well, when it's located in front of the womb, it presses on the bladder as well. You start having urinary symptoms. You can't hold urine for longer than necessary. If there's no bathroom very close to you, you may pee on yourself.
Okay. Okay, so these are the symptoms. Okay.
Sometimes it may be so big that it might even cause constipation. Because the abdomen is a tight place. That's where you have your kidneys, you have the liver, everything is there. So it may press on the rectum and constipation may ensue. In some cases, we have had very huge fibroids that were impinging on the kidneys. You now began to distort the anatomy of the urinary system, to the extent that even when you do blood tests, your kidney function begin to the tests for kidney function, you see some abnormalities.
Isn't it? Okay.
And I think that's basically then the ones that don't give any symptoms at all. They are just there.
They're just there. So
you don't know they are there. It's not going to affect you. You may even get married, have your babies. Probably is when you now go for antenatal. There's a fibroid.
Okay.
At that point, well, we have to deliver the baby. So since it's not really disturbing anything, it can as well stay there.
Okay, we're going to go on a quick break again, and when we return, we'll talk on the concluding parts of the program. We'll be right back for this.
At the King's Court is a program where we worship and praise the King of Kings and the Lord of Lords through various musical renditions. So join me, Eukaria Ozovehe, at the King's Court every Tuesday by 6 p.m. on this station, and it promises to be exciting and rewarding.
Welcome back, viewers. Before we went on the break, we're still discussing fibroids, and Dr. Odiegwu Maxwell is still with us here. So thank you, Doctor, for all the information, because I think it's an enlightening moment. And I want to believe our viewers are learning a lot from this. Now, when a patient goes to the doctor, how do they meet their doctor to discuss it? Because some people just come in already with a preconceived mindset of what they think they know about it. So what kind of discussion should you be asking your doctor? Because this is general, almost everything. People don't have that patience to ask the doctor's question and get the right information, especially on fibroids.
I think everything lies on the doctor. Different patients come. Some are not very much educated. Some are very well enlightened. They've gone to search on Google and they've seen everything that needed to be seen. But the doctor should be able to extract information, the one that is important and the one that is not.
Okay.
Scenario: doctor, I have fibroid. I want to remove it. It's left for the doctor to now try to find out how the fibroid came about. Is it the one we can remove? If it's not the one we can remove, can we check and be sure that there is nothing else that is making her not to get pregnant before you now start thinking about removing the fibroid?
Okay.
Because what I see maybe I see some clients, they've done fibroid surgery like 5 years ago and they are still trying to get pregnant. What it simply means is that maybe the fibroid is not what you should be chasing then, or maybe the surgery was even responsible for to get pregnant.
So fibroid on its own, growing in whatever part of the, especially in the cervix.
Yes.
Within the cervix.
In the womb.
In the womb
yes.
area. It's not actually the cause of infertility. On its own, just growing there, would it be?
If you want to list the causes of infertility, fibroid is like the lower rung of the ladder.
Okay, I see.
Because you need to really exclude all the other causes.
Okay, before you
of which the commonest cause is blocked tubes due to infections, followed by hormonal problems, fibroids.
Okay, so fibroid is the least of the matters.
Fibroids can cause miscarriage if it's within the cavity. Can.
Okay, that would be. Why would that happen? Because it's competing with the space, or?
Yeah, well, yes, implantation.
Okay.
And sometimes the size, it may be competing. But before fibroid can cause infertility, it must block the two where the fallopian tubes it must block, so that, because even if it's blocking one, the other side
is still
open for anything to happen. So it's left for the doctor to enlighten the patient.
Okay.
Do the tests, do the scan, see where the fibroids are. Do we or do we know? It's about ethics now. You mustn't do it because you want to do it. If it's not necessary, let her be. Try and find out why she's not getting pregnant.
Okay.
The problem is that if you say, madam, you don't need surgery now, she may go elsewhere to get the surgery done.
Yeah.
But at least do your own part.
Your own part.
Do your part.
Okay, so to clear the air,
yes,
this whole concept, because why people run to other forms of treatment is because there's always this thing, you have, like in my tribe, if you have to, they would say, do something about it, if not, you will never get pregnant again. So every older mother or older woman has already concluded that fibroid is responsible. You know, if you've got it, then you're never going to take it. But that is not the case that we're trying to clear.
It's not the case. You know, for the fact that you have fibroid doesn't mean that you cannot get pregnant.
You cannot get pregnant. But there are people that have gotten pregnant, you know, even with the fibroid at the same time. You know, I've seen, you know. In
so many. You do the scan, the fibroid is on one side, the baby is on one side. Before long, the baby now gets bigger than the fibroid.
Okay.
Then at delivery, depending on where it's located, you may deliver without surgery, you may deliver with surgery, depending on if the fibroid is obstructing where the baby is supposed to come out. You know, so
I'm happy to hear all of this because it's actually, you know, stops a lot of misconception out there on what fibroid is.
Quite a number of misconceptions about fibroids. Quite a number.
Number of them.
Yes.
So, but okay, now the next stage we're going to do, because we'll soon be wrapping up the program, is there so many myths out there. You know, people believe that this is it, and somehow I don't know if it's come over years. It's even more popular than the truth. You know, so that's what we're going to do. So I'm going to ask them, because there's so many people that, you know, have asked me these questions. You know, so I would ask and then you let us know. Is it true or is it a myth? Okay. So number one, I think we've talked about this, but we can't talk too much about it. After taking some herbs, a woman can pass the fibroid through her vagina or through the stool. So after drinking some of this concoction, a woman can pass out the fibroid or pass it out through a stool.
It is not scientifically possible.
It's not scientifically possible.
It's not. Because the way the fibroids are embedded in the womb, it's difficult for those fibroids to be shelled out.
Okay.
You can have pedunculated fibroids within the cavity, maybe hanging on a stalk. Even that will still need to be removed
surgically.
Yeah, you may not have to open up, maybe from below.
Okay.
You grab and twist. You still have to twist and pull before it can come down. So I don't know how
just by drinking something can do that.
Maybe it will shrink the blood supply. I don't know, but it doesn't sound plausible. There has to be some form of physical intervention.
Okay.
Yes.
So just like you talked about the caustic soda and all of that.
You know, when it's inserted, you feel pain. You feel that, okay, it's going to come out, but it's causing a lot of damage. Those are very delicate areas.
I think the mindset is when you take something hard, everybody feels, or people, not everybody, most people feel if you take something hard, then they think the body, the structure of the body, just when you take something through your mouth, it just goes straight to where it wants it to function.
No. In fact, there's no relationship between the gastrointestinal tract and the reproductive tract. There's no relationship.
They're quite different. So that's what everybody should know that's watching. If, for example, you're going to insert anything or drink anything, there's no relationship with that. For now, you shouldn't even insert anything.
Don't insert anything.
See your doctor.
Cause more problems for yourself.
Yes. So see your doctor. If you're ever told that you have,
because no doctor will tell you to insert
anything or drink any concoction.
No doctor.
So once anybody tries to say that, he's not a doctor. That person knows where he got his own profession from. Okay, now this is very interesting. Is it a bad thing for a woman to develop fibroid? Is it like a sin, or is it like?
Sometimes things happen to you that you don't even know. So
it shouldn't be a bad.
Yeah, it shouldn't, because it's not that having a disease and you now say it's a sin. No.
Okay.
Some of these things may have been caused by something, maybe genetic, or it has developed over the years. Like diabetes can happen to people when they are in their 40s and above. Probably increased dietary lifestyle, adding weight, then your diet, and you know, there are a lot of things, not exercising. You know, just like blood pressure as well. You know, so I don't think it has anything to do with whether you are a good person or not.
You know why I asked that question? Because you would hardly see any lady boldly come and discuss it that I have fibroid. There's always this conception that if you have fibroid as a lady, it's either there's something wrong with you, or I don't know, it's just what is out there. You know, it's among the ladies.
That's also what is causing problems, because an unmarried lady with fibroids may not want to remove the surgery until she marries.
Yeah,
remove the fibroid until she marries, because she feels that when there is a scar on the tummy and a suitor comes, when the scar is seen, it may reduce her chances of, because they probably will not know what happened.
Okay.
Why the surgery was done.
There. So it's not a bad thing. It's not like a crime.
It's not anybody's
like
fault.
Exactly.
When it happens, then you have to do something about it.
Okay, this I think we have talked about. I said a woman who has or had fibroid will never have children again.
That is not true.
Okay.
It is not true at all. Fibroids are not even the reason why you don't have children. In fact, there are more important reasons than fibroids.
Okay. Yeah. Okay, now this is an interesting. Doctors do not tell you the whole truth about fibroid. Is that?
Well, for every ailment, if you see a woman that has breast cancer, you want to be able to pass the information without causing much harm.
Okay. Emotional damage and
yes.
all of that. Okay.
Oh, madam, there's a tumor. We need to check, get histology out. Even when you are divulging the info. I'm just using breast cancer because it's a cancer.
Yeah.
Fibroid is not fatal. It doesn't kill. So I don't see
it doesn't kill.
It does not.
It's okay.
I don't see any reason why I will be economical with the truth when I want to tell a lady, madam, there are fibroids here. I may say, okay, madam, there are fibroids, but it's not a problem.
Okay.
At least you assuage her, all the problems. She's feeling bad about the fact that there are fibroids. You let her know that fibroids are not supposed to be problems. Fibroids should not stop you from getting pregnant.
Okay.
There are some fibroids that you may need to remove for someone to get pregnant. That happens as well. But it is not the commonest cause of infertility. It is not.
So if you look at the list, it's always down there.
It's always down
somewhere.
there.
Okay. If I have fibroid, I need a hysterectomy. I think hysterectomy should be removal of the womb.
Of the womb, yes.
The womb completely, yes.
It can only be done when you have completed your family size and you don't need the womb anymore.
Yes.
You have 5, 6 kids and the fibroids are still there. Why will you want to remove the fibroids?
When you can take out everything.
Yes, because even the womb, as you are getting older, there may be problems too. So if you have an opportunity to take them out at that age, because uterine cancer is there, cervical cancer, all those cancers of the reproductive tract, they are always locking.
The older the womb gets.
So if there's an opportunity for the womb to be taken out so that there won't be any of such problems later.
Okay, then you might as well take it.
Yeah.
Okay. Untreated fibroid will continue to grow. I think we talked a bit.
Yes, it will continue to grow, but the rate of growth varies from individual to individual.
Okay. So sometimes it doesn't. If some people just have their own. I know somebody that has had their own for years and it hasn't moved.
It doesn't. It doesn't. It depends. Some people grow quite fast. You remove the fibroid, another 3-4 years she's back. The fibroids are back again. It's not that new fibroids have started growing, probably because when you remove the fibroid, there are some that are so tiny, microscopic, you don't even see them. Those are the ones that now
come up afterwards. Okay, so if you don't need to take anything at that time, if it's not growing, leave it where it is.
If it's not disturbing you, in quotes,
leave it where
please
it is.
let it be.
Okay.
Because when you remove fibroids, is most likely to return after some years.
So now, is there anything been discovered why some grow, some don't grow? Does it have anything to do with our diet? Because it worries every lady. Like, I know I read somewhere, it says if you eat lots of sugar and all of that, the fibroid goes faster because cells feed on carbohydrates and all of that.
But everything that we eat, you have sugar in it. Yeah, so just the moderation is just the key.
Yes, okay. Okay, so we've talked about relationship between fibroids and infertility. You know, it doesn't necessarily mean you will never get pregnant.
No.
Again,
There may be other
causes
that you don't know. You don't know your doctor that will probably find out.
Okay.
That should be addressed first.
Okay.
Then you'll give some months. Try with your husband. Let's see. The fibroid is still there.
Okay.
If there's going to be a pregnancy, there can be a pregnancy even with the fibroid coexisting.
Good.
It's only when you have tried everything, you have tried for some months, 6 months, 9 months, nothing is happening. Okay, let's remove the fibroid and see
if you take it immediately.
Yeah.
Okay. So, okay, the last one, I think the last two, we talked about, do all fibroids need to be removed? No, if it's not causing any problem, then don't touch it.
Yes.
Then can fibroid kill someone?
No, it's not fatal.
It doesn't kill.
Fibroids can remain. You can get a 60-year-old woman now and do scan. She had 7 children. You may see fibroids.
Okay.
They were there. She probably did not even know. You know, so it doesn't.
Okay, my last question will be, what I asked in the beginning again, maybe towards when we started, a lady does not need to be worried if she has fibroids. She shouldn't be disturbing herself.
But if you have done a scan before and it says it's like, let's say 2 centimeters, maybe a year after, you can go and repeat the scan and see whether it's now 3 or 4 or 5.
Okay, with that you can measure the growth rate of it.
Yes, scan can give you accurate measurement of the diameter, so that you know how it's doing.
Okay.
And if there are no symptoms, I don't think you should bother.
You should bother yourself. So that is what we want to drive at. It's not the problem we make it, because is this making it look like some cancer or something that make young ladies go and they feel the doctors don't know enough. I've even heard somebody say, "Oh, my doctors, they don't know anything. Just go and drink this thing and solve your problem before you don't get married or you don't get pregnant again." So those are part of the
concussions can cause more problems.
More problems actually,
can cause more problems because you don't even know what you are taking. You don't know the dose. You're just given gallons take over months. When it finishes, come and collect another one. Like that, you keep on drinking.
And what is common among them is everybody that I've heard that taking this herbal concoction always complain of stomach pain, and then after some time when they don't take it again, they don't feel anything. So which means if you're feeling pain, then you're doing something that is not.
Yeah, those are some of these things. The stomach is not even a good place for them to pass through. Can cause problems.
Wow. Thank you very much for coming on the program. I think we have exhausted almost everything we have, for this discussion on fibroid. So the thing we want to take away is, I want to just go over it one more time.
Yes.
Fibroid does not kill.
Doesn't.
That's number one. If it's not causing any form of trouble after you've seen your doctor, please don't touch it, leave it. Don't drink anything. Don't insert anything. Leave it where it is. Then when you go to the doctor, ensure that the right tests have been done. It's not just an immediate have fibroid, take it out, but it should be something you discuss with
the doctor will also decide with you whether it should be removed
or not. And then the most of it, which has been the bone of contention or the problem for everyone, is it's not necessarily the one responsible for infertility.
It's not.
Not necessarily the one.
It's less important.
It's the less important. There's so many other issues that could have been responsible. So all those were running around thinking, oh, I have fibroid, which means I'll never take in, or I'll never get married because I have fibroid. No, that's not the issue. The issue is more than that. Thank you very much. I believe everyone that has watched has learned something from our discussion today. Thank you very much, Dr. Maxwell, for coming on the program. All right, viewers, that's the much I could take today for our discussion of fibroid. Now, we've pointed out that we've made the point clear. Please, please, please don't take anything into your system that will harm you or hurt you when you have fibroid. Just see a doctor and discuss everything that you need to discuss about fibroid. And please keep yourself safe. Thank you very much for joining me on the program today. I am Angela Mweze. Goodbye.